The most important technique for losing altitude is called big ears. It involves closing the two tips or stabilizers of the paraglider to reduce its surface area, which will help you descend. You won't feel a sharp drop in altitude. It's very subtle, but it helps a lot when you want to descend, or if you feel turbulence and want to stabilize the paraglider. How do you do it? Usually, you have two A risers. On this wing, they're marked as a capital A and a lowercase a. Although some wings aren't labeled, big ears are usually done by pulling the A riser that has a single line going to the stabilizer, the tip of the wing. So, when I tell you, do the big ears, without letting go of the brakes, you'll grab, in this case, the lowercase a, and pull it down on both sides and hold it. To do big ears correctly, it's necessary to pull the correct riser or line. If there's only one riser, pull the line that goes to the stabilizer. Modern paragliders have two A risers, a main one and one specifically for big ears. The main one goes to the center of the wing, so if you pull it, you'll cause a frontal collapse. The riser you need to pull is the one with a single line going to the stabilizer. The main riser has two or more lines, and that's not the one you should pull. Once you've identified the correct riser, pull it down firmly to create good big ears. A common fear for students is pulling too hard and collapsing the entire paraglider. That's not possible because the risers for big ears have a stop, and once you reach it, the big ears are done, and it's impossible to pull further and collapse the whole wing. When doing your first big ears, it's a good idea to look up and check that they're done correctly. You'll see a fold in the stabilizers or tips, a small collapse. When big ears are done properly, it's a stable collapse. If you pull too little and the big ears are too small, the descent will be inefficient, and the ears will constantly want to reopen, creating instability.